Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So, y'all, after almost 3 years, COVID finally got me. I got it, I guess when you hear this, almost 2 weeks ago. I got sick right after the last episode came out and was down for about a week. So not fun. Do not recommend. So as you can maybe hear, my voice is still not 1,000% yet. I'm still working out the last of my cough. I feel so much better now. I feel human again, which is delightful. But yeah, I have a cough that is still lingering. Hoping it goes away soon, because it is not fun. But it gave me a chance to take some time away from everything, and I stepped away from social media and just watched TV. I did some reading once I felt up to it. That first bit where I had a bad fever, and so I couldn't focus on anything. But once I got better, once I got past that and was just had a really bad cold, felt like I really had a bad cold. I was able to do some fun reading and just take some quiet time. I had a lot of pho, which was my happy place. I think I ordered pho 2 or 3 times while I was sick. I mean, just having a giant bowl of noodle soup, there's nothing more comforting than that. And it was definitely my happy place while I was trying to recover. So yeah, I'm feeling a lot better. But it meant that I wasn't up for doing a lot of things. I didn't do my normal baking over the weekend or anything. I just the energy I had was to watch TV, take a nap, order takeout, read a book, take a nap. I'm slowly working back to working full days. I've had to do a couple days of taking a nap at lunch. But I think I'm finally maybe in the place where I can work a whole day. We'll see. I get a little tired. Let's see what else. So I know we talked about on the podcast that rePROs grew beyond just the podcast. We grew into an initiative that is working on these issues beyond the podcast. And so we had our first big report came out. I think I've talked about this report I do in my old position when I was the Director of Public Policy at the Population Institute. We did a 50-state report card on reproductive health and rights. Well, this year was the first year we released it as a product of rePROs Fight Back. And that just came out last week. I'm so excited to release the report. It's exciting to see it come out under rePROs. So it shows that things are not good, right? It's the U.S. We gave an F because clearly things are not good for reproductive health and rights right now. And we had 26 states got failing grades and only 4 states got an A. So we'll make sure to include a link to the report card in the show notes, and we might talk about it more on an episode. But it was really exciting to release this big product under the new rePROs initiative. So I hope you all get a chance to check it out. Okay, with that, let's turn to this week's interview. I am really, really excited to talk to Erin Reed, who is a trans and queer advocate about all of the anti-trans legislation or bills that are happening at the state level. It was really wonderful to talk to Erin about these issues, and I hope you enjoy our conversation. Hi, Erin. Thank you so much for being here today.
Hi, thanks for having me on.
Before we get started, do you want to take a quick second and introduce yourself, including your pronouns?
Yeah, absolutely. My name is Erin Reed. I am a queer legislative researcher and activist. I use she, her pronouns, and I cover transgender legislation and life moving all around the country in the United States and even worldwide.
I am so excited to have you on today. I feel like, again, talking about all these issues is enjoyed the right word. I have appreciated following you on Twitter because it has really kept me so up to date on all of the things that are happening in the states that may be easy to miss, particularly around trans rights.
Yeah, and there's so much.
Yes. And I feel like before we dig into the specific buckets of things, maybe we should do a little big picture scene setting on this moment right now. It just feels like there is so much happening, and I feel like we say it every year, but it just feels like another big escalation and attacks happening around trans rights.
Of course. So this year we have, as of last I checked this morning, 325 bills targeting the transgender community moving around the country at various steps along the process of getting passed. This is more than the last 4 years put together, and in fact, likely more than the rest of the history up until this point put together. We just simply weren't tracking before 4 years ago. Anti-trans legislation that is passing or that is currently being proposed and moving around the country includes everything from healthcare bans for trans youth to even some trans adults. We see drag bans that also target the trans community and all gender non-conforming people who are in public. We've seen things like giving students the right to bully, the right to dead name and misgender their transgender peers and teachers, bathroom bans in schools. We've seen pronoun bans, birth certificate bans, harder driver's license changes, the whole 9 yards. We've seen several different kinds of legislation proposed this year.
It really reminds me of maybe 10 years ago around abortion, where it was there were always low level attacks, and then you just hit this cliff where it just kept going up and up and up, and so many they just multiplied across the states. And I really feel like we're seeing this exact same thing happen from the exact same actors in with trans rights now.
Indeed. And in fact, it is exactly some of the same actors using some of the same methods. We see the same organizations that were really active in the anti-abortion fights also doing the same thing in the anti-trans fights. We're seeing even some of the same tactics, such as the increasing in the age of what they're targeting with their anti-trans bills, kind of mapping onto how they used to handle or how they handle things with gestational ages. And so we see essentially then using the exact same kinds of tactics. So we even see some of the same arguments. In fact, just now, just before I got on with you, I was watching the Oklahoma bill, which just passed the Senate in Oklahoma. And a good 3 or 4 of the senators that got up essentially argued that this is a pro-life issue, that this is an issue of the right to reproduction and the right to have a baby, essentially, according to Republicans that say that essentially allowing gender-affirming care would reduce the number of babies being born. And so, yeah, this is all part of the same fight.
It's just so enraging. I just working on both issues or talking about both issues. It just feels like this never ending, nonstop attack on all fronts of bodily autonomy, trying to keep them siloed. I think often you see as well, trans rights are over here, abortion rights are over here, without seeing that they're very intersectional and overlapping, right? Trans people have abortions, people who have abortions are trans, all of this is all related, and it's all bodily autonomy, and we need to make sure that that all of these communities are talking together, especially when you're seeing the same tactics used.
Absolutely. And I feel like the siloing can be a little bit unfortunate sometimes because there are areas where activists for both can work together in amazing ways and accomplish amazing things. So, give you a really good example. I have been tracking bills that are essentially called safe state bills, and they are bills that I've seen passed in several places now. We saw it in Washington, D.C., Illinois, the Patient and Provider Protection Act. We saw it in California with SB 107 in Massachusetts. And these bills essentially state that if you are leaving a state that criminalizes your care, be it abortion care or trans health care, the state will give you certain protections against your health data being subpoenaed, against you being pulled back into the other state, against providers of that care from having to provide data to the criminalizing state, against telehealth bans. And so, we are seeing places where there is a joint effort in the movement. And in those places, we've seen these bills pass.
I have to say there was the Florida school board thing where they were wanting to track girls' periods, and as much as I work on where both buckets of issues, I have to say I really had my abortion hat on as I was thinking about it, and only thinking of it as an attack on abortion rights, and that's why they were doing it. And when I saw well, this is also a trans rights issue, it was well, obviously this is about trans kids playing sports. And I was so mad at myself for missing the obvious connection.
And in fact, if I remember correctly, the questions about periods were replaced with biological sex questions. And so, there are definitely ways that they're trying to use the same tools to target both people who have abortions as well as people who are trans. I'm also looking at, for instance, in Idaho. And last year in Idaho, there was a bill that would criminalize leaving Idaho to get gender-affirming care. The same week, there was also a bill in Missouri, or a proposal in Missouri, to criminalize people leaving the state to get abortion care. And we're still seeing this pop up in some of these states. And one of the representatives behind that bill in Idaho, and it's passed the Idaho House, it did not pass the Idaho Senate, Representative Young, stated that they saw this conversation as an extension of the pro-life argument. We're not talking about the life of the child, but we're talking about the potential to give life to another generation. And so there are so many cases where it's clear that they are linking these issues on the right. And I think that recognizing all of these and even other issues as sort of a constellation of attacks on bodily autonomy, attacks on queer people, attacks on women, attacks on femme presenting people, all designed to uphold essentially a biologically determined at birth gender hierarchy and supporting the patriarchy. And everything kind of works to that end to some of these people.
Okay. So maybe let's talk a little bit about the big buckets of attacks we are seeing on trans rights. And I think the biggest, and I was going to say most scary, but they're all really scary in their own way, is the attacks on young people's access to gender-affirming care. So the bucket of health. So what are we seeing?
Yes. So 1/3 of all bills that have been proposed, that's 97 bills this year, have targeted gender-affirming care for trans youth. Some of these bills are rare few, but some of them also target it for trans adults up to 21 or 26 years old. And we are seeing, in fact, in these hearings, and I've watched hundreds of hours of testimony, both this year and the last couple of years, we are seeing an increase in the proponents that are arguing in front of the committees that the brain does not stop developing until the age of 25, so we should really ban up to 25. And essentially, what these bills do is they ban gender-affirming care for transgender youth under 18. Typically, gender-affirming care for trans youth starts with puberty blockers whenever the age of puberty begins. Typically, we see that happen around 12, 13 years old. They allow you to go through the first couple stages. Puberty blockers are safe and reversible. They've been used for decades now. And then following that, around the age of 14, 15, 16 years old, after they've lived as their gender for a while, they'll transition to hormone therapy to experience puberty alongside their peers. Surgery is not done on trans youth, although most of these bills, the way that they are being fronted in the hearings and the way that they're being argued in the Senate and the way that even news articles are reporting about them is that they're bans on trans surgeries for trans youth. And the reality is, nobody is having bottom surgery under the age of 18, and a rare few people, almost imperceptible number of people, are having top surgery, which is just essentially breast augmentation or basically a flat chest surgery. And so for these groups of people, we see the focus on these edge cases again, drawing back to the abortion stuff, very similar to how, for instance, we saw late-term abortion fights. And so, they would focus on late-term abortion and then use that as a means to ban all abortion and all gender-affirming care. And now, as currently being targeted by these people. And so, yes, healthcare bans are currently moving in several states. They've already passed Utah and South Dakota this year. They passed last year, Alabama, the year before, Arkansas. Florida has such a ban, and Texas is currently in a strange area where they are defining gender-affirming care as child abuse and attempting to take kids from parents. Several of these bills are currently held up in court, but this is the landscape that I'm seeing. And then I'm also seeing 10 to 12 states probably likely to pass a similar ban this year.
And I think it's really important to mention that like gender affirming care is life-saving healthcare. Like it is so important to trans youth. I just find this absolutely horrifying.
Absolutely. So in a recent last year Journal of the American Medical Association Pediatrics article, they've showed that the provision of gender-affirming care reduces suicide rates by up to 73% among trans youth. This results in very meaningful lives saved. Trans youth have very high suicide rates, and they tend to find that after providing gender-affirming care, trans youth suicide and mental health care improve dramatically. And we've seen this. Like, I think anybody that knows trans kids has seen the improvement in so many of their lives. I've watched so much testimony. I remember watching in Nebraska. There was one testimony that I had watched where the mother was pleading with the legislature, stating that, prior to gender affirming care, she had a dark and depressed and suicidal son. And after starting, she had a bright and vibrant and happy daughter. And I think that like so many of us have seen this happen with trans youth. And so, yeah, it's life-saving care. And I think anybody that knows the people knows that.
It has been just really disconcerting to watch it just to, again, go from state to state and just see trans kids be used as like a culture war topic and not as people and like having their autonomy respected. It makes me so angry, and just my heart breaks for like all of the kids who are going to suffer because of this.
Absolutely. And I also want to point out like how quickly the Overton window has changed and how quickly we've progressed on this, like how quickly things have gotten bad. Because 3 years ago, the debate was like sports in a handful of states. And it was never about sports. It was never about bathrooms. The people that are pushing these bills, the Alliance Defending Freedom and the American Principles Project, the Heritage Foundation, also big names for people that track this stuff for abortion fights, they've outright admitted to the New York Times in a recent article that they want to end care entirely. The goal is elimination. The goal is to remove transgender people from being able to exist in public, just like the goal is to eliminate abortions entirely. And I think that, it's the people that are the way that this is proceeded has been very troubling to a lot of people that care about this population, and as a member of the population myself, it's been very troubling to me.
It just, again, like that abortion reminder of like where the 6-week abortion bans were like first introduced, where they were like wild, out of the box, like very few states would even consider them, and then all of a sudden it like sped up, and like that's where I feel like we're at right now with trans rights, of like there were like a couple states that were trying to do it and they were really outliers, and then now, like you said, it's the most there's ever been, and that's pretty horrifying.
It is. I will say, like there are a few little rays of hope that I've had. A few. Number one, even in the harshest states where these laws are being proposed, it would appear that Democrats are holding the line and that there's no like crossover on this. And so what I'm seeing, like in terms of a national picture, yeah, exactly. And like, so what I'm seeing in terms of like a national picture is the states that are supportive are increasing their levels of support. And then the states that are not supportive are decreasing and targeting the community more. And it's interesting because, like I see a state like my state, Maryland, even Maryland needs a lot, like they need to do a lot. And there's a lot that needs to be done to protect trans people here. And they are now, like this year, they're hearing a bill that would provide modern standards of care for insurance coverage because, even in states where things are not being criminalized, like insurance coverage can be very hard for transgender people. Procedures are very expensive. And so like seeing that movement makes me feel good. And then also, like, this is not a winning issue for them nationally, and it's not a winning issue for them electorally. This last election, they tried to make this a big issue in so many states, and they failed. They poured $1 million into Michigan trying to campaign at the state legislature level to ban trans care. And we've got our first trifecta in Michigan ever. We saw this in Pennsylvania. We saw this in, Wisconsin. We saw this in Arizona, where in the final week of the election, we saw the Republican candidate attack the Democratic governor's candidate with a message that, like, her husband was a therapist that saw trans people and, like, was attacking the candidacy for that. We saw in Georgia, Herschel Walker, on the last week of the campaign, released an ad sitting next to an athlete, and it was like against trans athletes. And so, like, these aren't winning issues for Republicans in the general election fight. Really, it's the far right that is sort of trying to seek ideological capture of their party. And so, there's work to be done. And I think that things will still bend in the positive direction in the future.
That gives me hope. And I needed that a little bit. And I really appreciate, like, because you're right. Like, there has been a lot of unity in the Democrats and, like, not giving in on this. And as somebody whose background is mostly in abortion, I really appreciate that, because that's not always the case on our issues.
Unfortunately not, no.
Okay. So you mentioned the Herschel Walker ad. So are we still seeing attacks around sports as well this year, or has that kind of fallen by the wayside to the, like, more blatant attacks?
So we are, but I will say that there have already been 20 states that have passed sports bans. So they've already gotten their low-hanging fruit on sports bans. And so I've seen 40 bills targeting sports, trans people in sports this year. Most of these bills are going into swing states, or they're going into light blue states. I have not seen them progress at all. They seem to be getting shut down. One of them did pass the Virginia legislature, or the Virginia House of Delegates, and it just moved to the Senate. And from what I'm seeing, it's going to die in the Senate. So, they're trying to push on sports, and they're trying to see if they can make ground in bluer states or in purple states. It doesn't appear that they're able to. As of right now, we do have a situation where half the country is banning trans people in sports, and half are protecting or, like, allowing trans people in sports. And it makes for very difficult circumstances for our few trans athletes that are out there. And I will say that, like, this fight is over a handful of people. I remember in Utah, whenever they passed their sports ban, there were 5 total trans athletes in Utah in the entire state. And they had set up a commission to determine somebody's biological sex if somebody was challenged. In the first 2 weeks of that commission, jealous parents targeted 2 cisgender girls. And within a week of that, the bill was halted in court. And, I think that, like, it's a little unfortunate, because it's like, of course, as soon as it starts to affect cisgender people, they're like, oh, well, we can't do this anymore. But I will say that, like, this is just a handful of people. And this small handful of people now has to navigate, like, a very difficult landscape. Like, how do you, as a trans athlete, compete in states that don't allow your competition? How do you not travel with your team? Do you hide your gender identity, which is something that, like, is a very common thing. People do feel a lot that they have to hide their gender identity. And so, yeah, we do still see sports bans. Sports bans are still in effect, and the effect of those bans is still sort of being sussed out right now.
Yeah, I was just thinking about, like, the 5 athletes in Utah. Like, how do you not feel that? So, I mean, like, I'm sure everybody feels it, like, so personally, because it's like an attack on, like, but when there's, like, 5 of you and there's, like, this big conversation at a statewide level, like, I don't know, feels even more of a personal attack.
Yeah, like, I mean, the state literally spent over $1 million to create this panel because of 5 people in their state. And like, again, the thing is that, most trans athletes are not dominating their sports. Like there are a lot of trans athletes that just enjoy playing intramural sports with their friends. Again, there's like focus on the rare few edge cases, and God forbid, like a trans person ever do well in sports because they get targeted so heavily by right-wing press. And so, and then like also a lot of these bills, they target like kids that haven't even been through puberty yet. It's like you have like an 8-year-old that can't be in a ballet class because their school classifies it as like an intramural. And so, there's a lot of discrimination and a lot of issues that like pop up around trans people in sports that like people don't think about. And again, it's not doing what people think that it does.
It just like goes back to like thinking of the mental health and like of like trans people and how there's that much higher suicide rate, and like things like this are only going to make that worse.
Exactly. I mean, again, like the way that you help trans people is just by giving them full inclusion in society and giving them the same sort of treatment you give anybody else of their gender. And trans people, one of the questions I had gotten to talk to Alana, she's an MMA fighter, trans MMA fighter, in a stream that I was in recently. She brought up a really good point. She said, instead of asking, about like trans people and like competitive advantages in sports, like the real question we should be asking is, why are trans people so underrepresented in sports? Because of all of the trans people that are out there, something like 1% to 2% of society under the age of 30 years old publicly identifies as transgender. Why do we only see 5 athletes in sports? And it's because, trans people are already systematically shut out of sports in ways that go beyond just sports fans. Sports is a human right. I think that a lot of people, a lot of athletes believe that and promote that. And trans people are far from dominating sports. They're underrepresented in them.
I think this leads to like, the far right, like boogeymen of it, right? So you have like, they were like using the trans athletes as their like boogeyman. And now it's like going after drag performers. And so now you're seeing a spate of bills introduced around drag.
Yes. And these bills are one of the new kinds of bills that we're seeing this year. They have been moving through legislatures, and what they essentially do, I'll tell you what they claim to do, and then I'll tell you like sort of what more they do than what they claim to do. What they claim to do is they claim to ban drag in front of kids, drag shows in front of kids. What they actually do, if you read the bills, is it bans, they use one of 2 sorts of languages around these bills: male and female impersonators, or people dressed in clothing other than their assigned gender at birth, doing performance, dance, or monologue. There are other kinds of, there are always other kinds of wrinkles that they throw in here. For instance, a lot of times they will claim to only ban it if it is appealing to the prurient interest, which is a complex sounding word that, most people don't use that word prurient very often, but it essentially means sexualized or causing sexualization in others. And the important thing to mention here is that a lot of times Republicans will push these bills, and in the hearings they'll say, oh, well, this doesn't ban anything other than sexualized performances. And then in the same hearings, you'll hear the proponents of the bill and the witnesses that come speak for the bill say that trans people and people in drag's mere existence is sexualized, and that drag queens sitting and teaching children how to read is sexualized inherently, or that dressing in drag inherently is a sexual act. And even some people that will make no distinction between trans people and dressing in drag. And so being trans is an inherently sexual act and should be kept away from kids. And this goes back to LGBTQ history. In the 50s, 60s, and 70s, we had something called the 3 Articles Laws. And the 3 Articles Laws essentially stated that every person had to be wearing 3 articles of clothing that matched their gender identity, or they could be targeted with arrests and fines. And these laws were used to target gay clubs, to target pride, to target gay people, trans people. And so whenever one of these bills passed in Arkansas, in their Senate, one of the senators got up on the floor, one of the Democratic senators, and said, will this bill ban pride? Probably. And that's because like you can't hold pride without people walking around in clothing that might be gender non-conforming. Another thing that these bills do is that they state, like, if you have a drag show, you have to be considered a strip club. You have to have a strip club license. And so what this is going to do is if a gay club or if a gay bar hosts a drag show, you're going to see cops come in and essentially take the bar's license away. I mean, this is something that we've seen before. This is part of our history. We've seen this in the 60s and 70s. This is what Stonewall was about. Like, this is going all the way back to Stonewall. It's the return of obscenity laws meant to target the trans community. And while most of these bills do have like that prurient section, there are several bills that go way above and beyond on this stuff. So like we've seen in West Virginia, one that would make it a crime for transvestite or transgender exposure, essentially exposing kids to being trans or transvestite or whatever. And like, it's scary. Like even to see these bills proposed is scary. In Arizona, we actually saw a bill that would ban Dolly Parton essentially because it didn't do the like dressed as gender assigned at birth. It instead said using exaggerated makeup and clothing to exaggerate gender signifiers. And it was like this bans a lot of like, if Dolly Parton came to Arizona, this would ban it. And you know, it's also been troubling for non-trans people too, because like,
yeah,
you know, I spoke to theater people that are really involved in theater, and a lot of people are concerned that like this can ban theater performances that have a trans person or drag in them. We could see shows like Rent banned. We could see, you know, Peter Pan. We can see Miss Doubtfire. Like all of these things could be banned. And so, yeah, it's a very troublesome set of bills. Thankfully, the two places where it's almost passed so far, Arkansas and South Dakota, both declined to pass it at the very last minute. And so we're seeing positive movement on that front. I'm watching Tennessee. I think Tennessee is one of the more dangerous states for this to potentially pass.
That's so scary for some. I mean, like they're all scary, but like it really just seems like they want to stop trans people from existing, right? Like because if just existing and being outside is a crime, like you're trying to get rid of trans people.
Well, yeah, and I mean, like if you take them at their word for all of the things they want to achieve, you know. And you can go down the list. It's like they want to ban learning about us in schools and libraries. They want to ban exposure to us in public. They want to ban companies repping LGBTQ issues. We see like woke companies, and we see acts that are targeting the quote unquote woke companies, especially in Florida. They want to ban online resources for trans people. I think that like Senator Hawley in Missouri just wanted to forward a social media ban for anybody under like 16 or something. And so they want to ban the states that are trying to be refugee states for people that are leaving these bad states. They want to criminalize our care. They want to label us child abusers or groomers. They want to ban pronouns in schools. I mean, if you take this huge list, and I can just continue to go on and on and on, this all amounts to essentially banning existence. It's hard as a trans person already to navigate all of the things that like we have to navigate in society. And to add just restriction after restriction after restriction after restriction on us, it makes a lot of trans people want to stay inside, which is, I think, part of the goal.
Okay. So let's like pause on the bad. Let's focus on what can we do? Like what needs to happen? You've already talked about some of the positive bills you've seen with safe haven states. What are some other things you would like to see happen?
Yeah, so like positive bills are obviously a good thing. Safe haven states. Seeing places codify the right to gender-affirming care. We've seen Massachusetts, and in a way, Nevada passed I believe it was a referendum on adding gender identity into their list of protections. That was a really good thing. And so like seeing those things get codified, I think that your listeners, especially thinking about some of the failings and some of the shortcomings of the way that like the abortion fight was done in the post-Roe v. Wade world, the post-Dobbs decision world, seeing trigger bans happen, like people weren't proactive. And like one of the things that I want to be really clear about is that we need to be proactive, both in ensuring that like the right to abortion is enshrined within all of our states and ensuring that the right to access gender-affirming care is enshrined in all of our states. That way we're not depending on the courts to completely swing the decisions, that one bad court decision one day could ruin things for everybody. And so like, I think focusing on that, focusing on not just what's happening now, but what could happen in the future and being proactive about our protections. I do think obviously like the safe state laws are important. I think that providing healthcare coverage is huge for trans people. We only have 3 states right now that protect gender-affirming care in all of its forms. Colorado, Washington, and Hawaii all mandate modern coverage for procedures that aren't 20 or 30 years old. A lot of the insurance codes for coverage of trans people come from our understanding of trans people and trans medical care 20 or 30 years ago. And that has evolved tremendously. Even very basic things like hair removal, which is so important for a lot of trans people, is not something that gets covered in a lot of places. And then for individuals, I think that like, it's really important, I think, for our allies to, definitely get to know like their local organizations and look at the fights that are in their own backyard, but also to take part in the conversation, to diversify their media diet. One thing that I remember reading about early in my transition several years ago, and it's really stuck with me, is that like, as a trans person, I have had to get around and get over so much internalized transphobia around trans existence because I was raised like everybody else. That's, over the age of 30 with very strict, gender hierarchies that we were brought up with. And I think that like I was exposed to media depictions of trans people and who trans people are. And I just remember like every time a trans person was on the TV, we were the butt of a joke. We were the laugh line. We were the tragic, we were either depicted as the person who was murdered, the person who was murdering, or the butt of a joke. And like that was the entire existence of transgender people for the longest time. And it's like that's changing in the media. And I think that it's so important that like people diversify their media sources and start to consume media that has trans people in it. Watch something that Elliot Page is in, watch Amy Schneider's historic Jeopardy run, like include trans people in your social media diet. There are so many people doing good work out there. And I think that like, this is going to be more than just a legislative fight. This is a cultural fight. And this is one that like, I think part of the reason why Republicans are focusing so hard on these legislative fights right now is because they know that they've already lost the culture war. And so they're trying to legislate away what they can't win in public. And so anything that people can do to help that along, to expose, your kids to transgender people, let them know that they exist, expose yourself to transgender people. I think that that's a big thing that can be done. Exactly. There are so many.
Read the banned books.
So many banned books that are really good, that are just so good. And so that would be nice too.
Or not banned books, just books by trans authors.
Exactly.
Well, I definitely recommend following Erin on social. I found her on Twitter and learned so much and have been able to keep up with all of the state level attacks. Also, check out her Substack. We'll make sure to include links to all of the things in our show notes. But Erin, thank you so much for being here.
Of course. Thank you so much for having me on.
Okay, y'all. I hope you enjoyed this week's episode. I am ready to quit talking because my voice sounds like it's about to give out. I hope you enjoyed my conversation with Erin. Like I said, I had a wonderful time talking to her and learning more about everything that is happening about the state level and seeing that there is some good news happening in some states. So it wasn't all bad. Yeah, make sure to follow Erin on social. She's on TikTok and Twitter, and she has a great Substack that you should check out. And with that, if you have questions or any topics you would like us to cover, please feel free to shoot me an email at Jennie, JENNIE, at reprosfightback.com. Or you can reach out to us on social media. We're at rePROs Fight Back on Facebook and Twitter, and rePROs FB on Instagram. Otherwise, I will see y'all in 2 weeks. Bye! For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com.
You can also find us on Facebook and Twitter at rePROs Fight That, and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.